Tim, I just wanted to ask you, many of the needs of the patient with mental health issues are particularly complex, and you started alluding to them earlier, and they're challenging. Could you describe some of the more difficult areas in mental health?
Well, I think the overlap between criminal justice services, mental health services, drug and alcohol services, child and adolescent services is particularly complex. And service users can fall between the different services provided, and that's a real concern, because these are often the most vulnerable people and have the greatest burden of disease, which affects all of our societies. Services, in terms of, I mean, I run specialist services and drug and alcohol services. Drug and alcohol services have been part of a competitive tender for a long time already, so we're a little bit ahead of the general mental health services. What that has done is it's forced us to become more efficient, dynamic, invest in partnerships, and that's really good, because as an NHS provider, there are some limitations to what we can do, and partner organisations can be much more dynamic. They're often better at engaging with communities, and it's this overlapping, ensuring that services are overlapping, not having gaps in between, I think is really important. Fundamentally, what we know in terms of drug and alcohol, for example, is that if you're prone to social deprivation, to stress when you're growing up, you're much more likely to develop a drug and alcohol dependency. So what we need to be doing is helping communities at the first instance to prevent these things happening, to prevent the enormous amount of expenditure that we have to, in terms of criminal justice and drug and alcohol treatment. So it's trying to get people to work together. Social care is really important, working with the local authority. I have to say, really, in terms of, we've got a new body, Public Health England, but the biggest public health failure in the last 10 years was the dropping of the minimum price for alcohol. In terms of an improvement in the global well-being nationally, it is a simple, cost-effective step, and that was being ignored by government. So again, we've got to get much more savvy at lobbying government. Public Health England were a failure in terms of preventing the government dropping the minimum price for alcohol. So we're not working together well enough as a system, and we need to be more powerful in advocating effective treatment options.
Do you think there's any kind of move in our city for that kind of much more joined up?
Absolutely. I think I'm really pleased to see that the city and the Director of Public Health in Bristol has been really positive, looking at some of those changes that haven't happened nationally and trying to get some local policies that can affect change. So that's been really welcome and making up for some of the shortfalls nationally.